As Greg said, I am a Professor of Clinical Psychology at the University of Manchester, and my speciality is in mental health, and particularly in severe mental health, people with psychosis and schizophrenia, and that's what I'm going to talk a little bit about today. My main area of interest is in how we can develop new treatments for people with psychosis and schizophrenia and improve functioning, improve symptoms, and improve lives of people who have this serious condition and their families and carers within the community. So just to say a little bit about it, this is something that's a quite contentious topic. So psychosis is a general term used to describe a set of experiences. It's not a diagnosis in itself. However, it's often associated with a diagnosis of schizophrenia, which is a term that many people will be familiar with. Psychosis in itself is not schizophrenia, but psychosis which persists and is associated with an impact on functioning does tend to then attract a diagnosis of schizophrenia. And I'll say something more about that as we go along. So what exactly is psychosis? Well, there are lots of definitions, but on the whole, it's a mental state where an individual's experience of reality is altered. And it's often characterized by particular symptoms, hallucinations such as voices, or delusions where people have unusual beliefs. Hallucinations, which are often most often voices, but can be visual hallucinations or other types of hallucinations in other senses, are experienced by the individual as real perceptions. And the experiencer usually believes that they're not their own thoughts, they're different from their own thoughts. They also experience often delusions, which are what's classed as inaccurate, often extreme beliefs, such as paranoid or persecutory beliefs, which are not shared by other people within their own culture. So, for example, in this culture, persecuted by MI5, transmitters in the brain, giving out secrets to government organisations and so on. But just to give you an idea of the scale of the schizophrenia and psychosis problems, a review was done going back to 2012 now by a number of charities and the government to try and review some of the services that we have for people with psychosis and schizophrenia. It's an illness that affects a lot of people, and up to 1 in 100 people at any one time would have a diagnosis of schizophrenia. And this quote from the report is actually quite powerful. You know, imagine suddenly developing an illness in which you're bombarded with voices from forces you cannot see, stripped of your ability to understand what's real and what's not. You can't trust your senses, your mind plays tricks on you, and your family or friends seem part of a conspiracy to harm you. Unless properly treated, the experiences may destroy your hopes and ambitions, make other people recoil from you, and ultimately cut your life short. We know that the average life expectancy with someone with this diagnosis of schizophrenia is 20 years less than someone without that diagnosis, due to the physical problems associated with it, as well as the mental problems. And 220,000 people in England have such psychotic experiences. We all know lots of people probably who are affected, but there's a great deal of stigma attached to the diagnosis. A link to the report is on the slide there. So when people hear the term psychosis or schizophrenia, people often have a reaction to those terms. They do have a stigmatized reaction to them. But people experience psychosis. They're not born as a psychotic or a schizophrenic person. And it's a normal phenomenon to experience psychotic-like symptoms that most of us at some point in our lives will experience in some form or another. But in the media and in the general population, diagnosis of schizophrenia or psychosis is often associated with things like being dangerous, being mad, being unpredictable, and that it's completely ununderstandable to everybody else. So things like these sorts of tabloid headlines probably don't help that. So these are things that have been cut out of some of the tabloids: violent, mad, living next door, schizo-knifer, schizo-plumber, knifed people, man killed by freed patient, sick murderer locked up, are all the sorts of media and unpleasant stigmatizing portrayals of people with psychosis and schizophrenia that the media presents to the population. These are a couple of quotes from the tabloid press. I won't say which one. Things like a string of similar killings by dangerous mental patients freed from hospital under the care in the community system. Experts estimate as many as 40 murders are carried out each year by people with severe mental illness. But we do know that actually quite a lot more murders are carried out with people who don't have severe mental illness. And in fact, there's all sorts of ways that the media is exacerbating some of these things. So things like some of the major retailers, again, which I won't mention names, but some of the big online names, are selling mental patient fancy dress outfits. And these are portrayed as people wearing white coats covered in blood, carrying axes or other sorts of weapons. And that's caused a huge backlash from service users and service user groups. This is one from Rethink, which is the national UK mental health charity, who put this out in response to some of the big retailers trying to sell portrayals of people with psychosis and schizophrenia or mental health disorders as being mad or dangerous. And as you can see from this picture, this is someone who looks like anybody else of us. So there's a lot of stigma attached to it. And there are lots of facts and lots of myths. So, as I've said, like people with psychosis are dangerous, that people with schizophrenia have got a split personality. A person with psychosis and schizophrenia can't recover, and a person with psychosis can't work. Or people with psychosis have to take medication for life. None of those things are actually true. In fact, people with a diagnosis of schizophrenia are not dangerous generally and commit only a small proportion of violent crime. Only 5% of homicides are committed by people with a diagnosis of schizophrenia, and actually are more likely to be victims of aggression and violence than the general population, so they're more vulnerable. And are the same as everybody else. They can work, they can study, they can recover, and don't have to take lifelong medication. So what are some of the causes of psychosis? Well, there is no single cause of psychosis, and decades of research into the causes of psychosis and schizophrenia have not really led to any absolute conclusions. But we do know that social factors, biological and psychological factors have all been shown to be implicated and to interact. And it's very individual. Sometimes psychotic experiences can be triggered by something relatively minor, or for others, even severe trauma, for example, doesn't result in psychosis. But some of the causes do include, we know, some types of drugs like reality-changing drugs like LSD, skunk, cocaine, etc. have been implicated in triggering psychosis, but also psychosis present in other types of brain diseases like Alzheimer's disease as a result of brain injuries such as trauma or stroke. But also psychosis can appear after extreme stress such as trauma, experiences of war or kidnapping. We know that the social environment can be important in determining whether people may have psychosis. But we also know that there may be some implication of genetics, but this is also very unclear. So twin studies, family studies and adoption studies have shown that there may be some evidence of a genetic component to schizophrenia. But actually most people with schizophrenia don't have any relatives with the condition. So it's pretty widely accepted that there is no single gene that we can identify for this. And it's true that many genes may be associated with the vulnerability traits that may lead people to be more vulnerable to experience psychotic experiences, but only in the presence of other factors such as social environment and trauma and other things. I mentioned that drugs can be important. One of the big things that's been implicated in the development of psychosis is skunk or cannabis, and it's particular types of cannabis with high concentrations of THC, which seem to lead to a really high increase in psychosis for particular groups of people compared to those who never have used cannabis. And there seems to be a dose-related response, so the more skunky use, the highest risk of psychosis. But it only seems to be in a particular subgroup of people. But we do know that social factors are really important. So psychotic episodes often follow stressful life events. And people with psychosis are more likely to have experienced trauma, particularly what we call interpersonal trauma. Those that are, for example, sexual, physical, or emotional abuse by other people, so interpersonal, compared to the general population. And we know that there's a dose-response effect with this too. So with those that experience more of those types of events, there's more likely to experience more severe symptoms. We also know that schizophrenia is more prevalent in urban environments. The reasons for that are not really well known. In terms of outcome for people with psychosis, outcome is really variable and it's really unpredictable. Some people completely recover after just one episode of psychosis. Others will have periods of wellness, but then be at risk of relapse. But others may continue to have persistent and distressing symptoms such as hallucinations and delusions despite treatment for most of their life. In terms of treatment and a bit of a history around psychosis, psychosis wasn't always so stigmatized in the way that it is now. People with mental health problems in ancient times were often revered, you know, in the sense of being spiritual or special beings. So, for example, that they could communicate with spirits and that they were special because they heard voices. Socrates was one of those people who was renowned for hearing voices. And later on in history, people were starting to be a little bit more stigmatized, to be considered outcasts. Things such as being deemed as witches or possessed by demons or spirits. And religion had a greater role in this sort of period, with the idea that they had to exorcise or cleanse such people of those evil spirits or demons. More recently, in the last couple of 100 years, with the rise of medical profession and treating mental illness became seen more of as a disease, but a disease which was incurable and lifelong, so required care and restraint. And this led to the development of the asylums, particularly in the UK. These were often huge Victorian buildings, which became mini towns and asylums for people, where people with mental illness were sent to be looked after and to live for all of their lives. And some of the early treatment was pretty much not evidence-based. Insulin comas, adrenaline, straitjackets were used, and a bit of locking up an asylum from the world. It worked well to provide a safe haven for other people, but reduced the likelihood of recovery and fostered institutionalization of the residents, making them incapable of returning to the world. This is one such asylum, Free and Hospital, aka Coney Hatch Lunatic Asylum in London, in operation from 1851 to 1993, and that was a place where I worked. At the time of its construction, it was the largest and most modern asylum in Europe, with 3,500 patients. It's had one of the longest corridors of any building in the UK. It took about 2 hours to walk the wards. The estate had its own water supply, chapel, cemetery, and a 75-acre farm estate, a gasworks, a brewery, and an aviary with canaries. It was really a mini town. It was sold in 1993 and made into luxury flats called Princess Park Manor, with some notable residents. Cheryl Cole and One Direction, Harry Styles lived there. This is a picture of that corridor. In relation to medication as a treatment for psychosis, it wasn't used systematically until the 1950s. Two French doctors, Delay and Denneker, noticed the benefits of something called chlorpromazine, which was an anti-nausea drug on symptoms of psychosis. And this led to the development of such drugs to treat psychosis, and they're still widely used as a first-line treatment. But they're not always effective. Some people recover using meds, but about 2/3 don't. Also, people experience persistent anxiety and depression, etc., despite the drugs. They can also have unpleasant side effects, which some people can find hard to tolerate. So there is a need for psychological treatments because medication isn't always effective. Symptoms are distressing, and there are secondary problems of anxiety, depression, and stigma that we can treat using psychological treatments. And there are inflated suicide rates, which make people want to talk. Also, despite concerns from some, talking is good for people, and people do think that talking doesn't make things worse, which is a concern for some people. And people welcome talking about their symptoms. They're often frightening and difficult experiences. Focusing on voices or hallucination makes them less frightening and more understandable. And there's a step change in treating psychosis through therapy rather than just medication. And symptoms are understandable. Often people's voices and unusual beliefs, called delusions, are understandable, when explored in the context of their experiences. For example, someone hearing critical voices may match the way the individual thinks about themselves, thinking that they're worthless or useless. An extreme paranoia may stem from a history of being in threatening and stressful situations. Hallucinations about previous trauma may manifest as distressing images or voices from the past. So psychological treatments are now routine, and in the UK, NICE recommend cognitive behaviour therapy for psychosis. They recommend its use to all people with schizophrenia, start in the acute phase or later, including inpatient settings, along with family interventions. So what is CBT? It's a talking therapy, usually delivered on a one-to-one basis. It involves specially trained therapists, often psychologists, but doesn't have to be. It typically lasts for 16 to 20 sessions over 69 months. It's collaborative. The therapist and the patient are equal partners. And the aim is to explore what the hallucinations and delusions are like. What's their content? How does it make them feel? What impact does it have on their thinking and behaviour? However, despite we know that these treatment works, implementation is tricky. We need to invest in more therapists to make sure we have a trained workforce. And we need to focus on different ways of delivering therapy, such as mobile phone apps, self-help, internet resources, particularly at the moment when we're not able to do so much face-to-face work. Thank you for listening.
Thank you very much for that. Some interesting questions have come through to ask about. So the first one, somebody was just wondering, do you find the way that psychosis is portrayed in a negative way has an even further negative effect on the people with it?
Yes, absolutely. It makes it more difficult in all aspects of people's lives. So it impacts on the way that people can interact with other people. People can be frightened about the reactions that they get from other people. Lots of people have experienced stigma in relation to employment and education because of the views that people with psychosis may not be able to work, or they may be dangerous in the work situation. So it has a huge impact on individuals. And what can happen is that people then can internalize that stigma, and they have their own views that they ought to be stigmatized, which then impacts even more on the experiences.
Thank you. Another question is, somebody's asking, are there ways for people with psychosis to be involved in research about their condition or management of symptoms? And what are some of the challenges of this?
Yes, we work with lots of service users in the research and the clinical interventions that we're developing. So we employ service users as researchers, so people who've got a history of psychosis, to work alongside with us. We have lots of consultation groups of service users who work with us in the university. Some of the problems with that, well, generally, there aren't so many problems. Sometimes there are times when people are not feeling well enough to take part, and their symptoms or experiences may mean they need to take a break for a little bit of time. But generally, those things are managed very easily. We have to provide additional support and training for people often so that they can become familiar with sort of research processes. But there's a lot of stuff going on around training service users to be able to be partners in research and development of new interventions, and to be sort of key stakeholders in how we deliver the treatments as well. So it's a good thing, and we're doing it a lot.
Sounds interesting. We've got another question here that you mentioned there may be a vulnerability within the genes if people are in a particular situation. Do people that may be in this vulnerable category get specially advised to make themselves less susceptible?
No, because we're not able to determine who those people would be. As I said, the genetics research has not revealed that we can determine any particular gene or set of genes which may make people vulnerable to psychosis. And I guess it's there may be multiple hundreds of genes that determine whether someone may or may not be vulnerable to psychosis, and we don't know that. We just know that some people are more vulnerable than others, and we can't predict that. But what we do know is that certain environments and stresses do have more of an impact than others. So we can, make sure as a society that we're providing ways to support and help people in all of those things.
Okay, thank you. And we have one last final question for you. Someone's asked, how has the emergence of e-cigarettes as a delivery of drug mechanism, for instance, using cheap legal household chemicals termed waspin, impact on the number, variance and severity of psychosis cases?
Well, that's a really good question, and I have no idea how to answer that. As far as I'm aware, we don't have any data which relates to that, but it's an interesting one that I will look into. But as far as I'm aware, we don't have any indication that the usual type of smoking has any impact on psychosis. But if, I guess, you're using particular types of drugs in that way, it's likely to have some sort of impact. But as far as I'm aware, it has not had an impact. But I will look into that. So thank you for that helpful suggestion.
You might be able to get a research grant out of it.
You never know.